During the past few years, we've seen a dramatic rise of knee injuries among mainly young people, aged 8 to 23 years. In different countries all over our planet, studies were performed about the occurrence of knee injuries. Especially recent work from Australia showed clearly that the health and well-being of children and adolescents are at risk. The anterior cruciate ligament, ACL, is a major stabilizer of the knee. While functioning, it protects the two shock-absorbing systems, the medial and the lateral meniscus, from overuse and future damage. A meniscal tear will lead to degenerative changes and finally arthritis. Therefore, an intact ACL is fundamental. This small but crucial ligament is about 2.5 to 2.8 centimeters long and about 8 to 10 millimeters in diameter. It is the most examined and researched ligament of the human body, with more than 26,000 scientific publications. An ACL injury is a life-changing event. The rehabilitation is a long and winding road, with or without surgery. Moreover, it is a fact that the long-term effects of an ACL injury are devastating regarding functionality, activity, and pursuing active life happiness. An ACL rupture, with or without surgery, means neuromuscular and strength work for life. Especially in the young population, researchers have shown that also the negative psychological effects of an ACL injury are intense. Statistically, the risk of an ACL injury is 6 to 8-fold higher in girls than in boys. Multiple factors account for this dramatic difference. Some cannot be altered, such as anatomy or hormonal status, whereas others can, neuromuscular control. Studies performed in the United States of America and Scandinavian countries since the early 2000s show that certain exercises, used also as warm-up sessions, can reduce the risk of an ACL injury by 50 to 60%. These exercises include balance, strength, speed, and plyometrics, jumping. Combining these exercises is mandatory in order to reduce the risk of knee injuries and keep athletes active instead of injured. In the past especially, professional athletes had already been trained according to these types of exercises, but the main population of athletes has not yet been part of the risk-reducing approach. ESSKA, the European Society for Sports Traumatology, Knee Surgery and Arthroscopy, is about to change this. ESSKA brings together orthopedic surgeons, clinicians and scientists in Europe, along with their various societies, in order to improve the well-being as an athlete or patient. ESMA, the sports section of ESSKA, brings to you Prevention for All. We have joined forces and composed 3 sets of exercises based on research and experience from the United States, Norway, and the Netherlands from the past 10 to 15 years in order to reduce the risk of knee injuries. Each set of exercises corresponds to different sports levels and age groups. Whether used as a standalone program or as a warm-up session while training for athletes, this prevention program will simultaneously improve performance and reduce risk of knee injury when carried out regularly and properly. We want to spread the concept in schools, sports clubs, sports associations, and to sport practitioners in general. We as ESMA want to improve patient care throughout Europe with high-quality educational programs. We bring together different professionals from sports medicine to collaborate on the most important topics of healthcare in athletes. Stay active, implement warming up in your sports, and prevent having an old knee in a young athlete. We care about ACL, which implies we care about your knee.